When I was teaching at Colorado State University at the Veterinary Teaching Hospital, we were trying to figure out what was a context, what was a framework that we could put our work into that was a little bit bigger than just grief counseling, because that's a very narrow sort of topic to teach. So we coined the phrase bond-centered care or bond-centered practice, which really means that it's a staff, a veterinary staff, who's really focused on caring for the bond, not just their animal patient, but also including their human client. And really, really focusing in on what is this relationship like that is right in front of me here? Is it a real strong, almost family bond, parent-child bond, or is it a more detached, not as strong bond? And so we were teaching them to assess that relationship and then proceed accordingly in terms of, what does this person need from me? What does this animal need from me? And what that really translated to was cases where, let's say, an animal's dying, maybe they have a couple of days, they don't need to be euthanized right now, they have a little bit of time, and the family wants time for a child who's at college to travel home and be able to be there when their animal is euthanized. In the past, in the old paradigm, nobody would ever think to do that. Veterinarians wouldn't probably suggest it. Parents or families would probably be too intimidated to ask for that. And so there was a lot of grief that happened for children at college or people who couldn't be there to say goodbye to their animals. So with bond-centered care, it's looking at the whole system. Who are the people involved, what do they need, and how can we meet those needs? And veterinarians are doing a beautiful job of that. They are really, really focusing in on their clients, their human clients, as well as their animal patients, and setting up a goodbye or end-of-life care plan that really tries to meet everybody's needs. In fact, a lot of veterinary practices or universities are even now offering pet hospice programs. And so the hospice program consists of palliative care, pain management, allowing, in some cases, the animal to die a natural death as opposed to being euthanized with the family in attendance. So the field is really evolving into a much more sensitive attention to what do the people need in this situation as well as what is best for the animal.